there are many factors that can affect your breast cancer risk. Here to discuss how age and breast density play a role is surgical oncologist Dr. Mojola Omole. Always here to help us out with your info. Thank you. Now, Dr. Omole, in the U.S., the recommended breast cancer screening age is now 40. Why have you been advocating to have that change happen in Canada? Because in Canada, what, we're still stuck at 50?
So it really depends on what province you're in.
Okay.
BC, you can self-refer from the age of 40. Alberta is 45. And then all the rest of us in the middle and going east is 50.
Okay.
So part of it is, first of all, we know that the recommendations that were made in Canada were based on actual flawed data. And they grouped people together, and it wasn't as accurate. In the US and the UK, which is similar, especially the UK in being heterogeneous the way we are in Canada, they start screening at 40. We get our bang for our buck in terms of screening and preventing people dying from breast cancer when we start screening earlier. And that's what the task force has come out with. In addition, we know that when we look at certain groups of people, so people from Chinese descent, women from Latin America, people from Latin America, and also people who we consider black, but mainly it's actually people of West African diaspora population. So anyone from West Africa or part of chattel slavery, so African Americans in the Caribbean, we actually all present an earlier stage of breast cancer than our Caucasian counterparts, probably about 10 years sooner. So for example, this shows you that what you would feel. So the biggest one is what you actually would feel if you were feeling a lump in your breast that's cancerous.
I'm just going to pick that up for them to show them. So if you're actually doing a breast self-examination, it's got to get to that big before you feel anything. So that's a big bobble.
And the top one is what a mammogram picks up. So
this little bobble is what the mammogram would pick up, which is why you need the mammogram.
And what that translates to is a difference in your stage. And so at this stage, you might just have surgery, maybe radiation, and some medication.
Yeah.
As you get bigger, your chances of it spreading and you having to have chemotherapy goes up. So that's why it's important to screen earlier and to screen yearly.
Okay, that's a very good point. And it's interesting that it has to be that big for us to actually feel it.
Yeah, it's pretty big.
Oh my goodness. So journalist Katie Couric, a lot of people know this, has been vocal about the importance of mammograms after her own breast cancer diagnosis. She's touched on the fact that she has dense breasts. I've been told I have dense breasts as well. So can you explain what breast density is and how it affects this whole equation?
So what breast density is that you have more breast tissue. So we actually don't know the full mechanism of what it means to have more breast tissue. Does that mean that you have more estrogen that's going to be circulating in your body, which increases your risk of breast cancer? But if we look at this two props, so this is a breast that is less dense.
Okay.
As you get older, your breast gets fat replaced for some people. So think of it as, you know, when we're doing a mammogram, we want to squish the breast between two plates. So my hands are two plates. When you have a fat replaced breast, so it's a very soft and plushy, I can squeeze that and we'll be able to see what we need to see in the mammogram. Now, if you have more dense breasts, it's harder to actually squish this. So you'll be able to see less when you take the x-ray, which is basically what a mammogram is. What it means is that things could be missed because you're not able to see things properly. And certain people do have denser breasts. So again, Asian women, people from Latin America, and black women have denser breasts. So there's less fat replacement as they're aging.
Okay. Let's actually have a look. We have a photo, right, of breast density, just so you can see the difference between these two breasts. So one breast is what and one breast is what? What is the difference between these two breasts?
So the breast that's on the left-hand side is basically this breast. So that is an older person's breast, a more fat replaced breast. So you're able to actually squish it between the two plates and see everything. What you're looking for on a mammogram is little calcium deposits, which you see when a cell is turning over fast. That's a sign of some sort of atypical cells or a sign of cancer or precancer. The other side, what you're seeing is a very dense breast. As you can see, there's a lot of white spots. So it's actually harder to see if there's a mass in there or if it's a calcium deposit in there.
Can you tell if you're doing a self-breast examination if you have dense breasts?
I would say in general, I view it this way. If your breasts still look the same as when you were like in your 20s, in your heydays, you probably have dense breasts.
Who is that? Is there someone that has breasts that look the same as in your 20s?
So a lot of Asian women do.
Really?
It still stays up there.
Oh
but if your breast is kind of like your if it's more like your grandma's breast, so it's like we're getting to like a little bit before the belly button.
Yeah.
That's probably a more fat replaced breast with less, because the point
Maybe they're not as dense as I thought, okay? Just look away.
A little sag is normal, especially if you've used your breast for breastfeeding.
Yeah.
But if it's that kind of like, you know, I always say like my grandmother's arm is like, it's nice and fatty. You put your head on it, it's so soft and pillowy. That's a less dense breast.
Got it. Okay, it's soft and squishy and nice. Okay, what are the recommendations for screening if you have dense breasts?
So there's no specific recommendations if you have dense breasts.
Yeah.
But we do know that, especially if, and I encourage people to go to breast screening centers.
Okay.
So those are often attached to hospitals, like we have one in Scarborough, Women's College has one, because we have dedicated radiologists that read breast mammograms. Oftentimes, if it's quite dense, they will recommend doing an ultrasound, or if there's a suspicion for something, an MRI.
If I demand, I want a mammogram before 50, is there a way I can get one? I've had one already because there was something, so they had to check it out. But what if you're not in that situation?
I would say that, it's part of its advocacy for yourself.
Yeah.
You simply can say, you know what? These are the reasons why I think I'm at risk for breast cancer. This is what I'm nervous for. I would like a mammogram. They will not turn you. You can't self-refer in Ontario, but you can ask your practitioner, your primary practitioner, that I'm concerned. I want a mammogram. So 100%.
Very good, doctor. Thank you for that, Dr. Omole. We're headed to break. We've got more Cityline coming up. You're awesome. Thank you. Be right back.